Yeah, I want to welcome you to our first session, SPAEN Coffee Chat session. It's an honor, and it's really happy to see you all happy and smiling and meditating. My name is Katrin Schuster. I'm here for Sarcoma Patients Euronet, but also for the German organization, the German Sarcoma Foundation. And it is my great pleasure to introduce you to Marcus Wartenberg and Gerard van Ootmassen, who are the current co-chairs of Sarcoma Patients Euronet. I would also like to introduce Michi Geisler, my colleague, who is here for any kind of support or any kind of questions you might have. And last but not least at all, I would like to introduce you to Sam Hackett, who is from Sarcoma UK, or British charity. And she will be the chair and moderator of our session today. So as I said, Coffee Chat is our topic today. What is the Coffee Chat series? It's new, so I will quickly introduce that. It is an interactive webinar series that we've created for patient advocates, for exchange, for discussion, because we all know that you guys, you have a lot of experience, a lot of best practice examples, and we think that's really worth sharing with the wider community. And we also want to discuss with you. We want to hear about your challenges and see if we can learn from each other, because I think it's especially in those times, it's quite true that we're facing a lot of same or at least similar challenges. So this is a platform we created for you to interact, to discuss, and yeah, to get together. So our topic today is actually that, peer-to-peer support in sarcoma patient advocacy and staying in touch with patients. And before we start into the session, I have a few very short housekeeping notes, something that you should know. So we would really like to see you and hear from you. So please enter your name and country by clicking on the name on the left-hand bottom of your screen and rename it so we can actually see who's on the call. If you're okay with that, please switch on your camera, because I think it really facilitates the discussion afterwards. And we would ask you to ask all your questions, but please after all the presentations, and you can do that by just raising your Zoom hand, by typing into the chat, or simply speaking up. What you also need to know is that we will record the session and we will publish the presentations. If we publish the discussion, really depends on how sensitive the topics are going to be. If you're not feeling comfortable with this being published, let us please know. Something I didn't put on the slide here, but I think is really important, and those who have joined our conferences already know this. Our conference language is, and that holds true for our webinar here as well, is always bad English. So don't hesitate to speak up if you have any questions or you want to make a comment. And with this, I would like to hand over to Marcus for a few welcoming words.
So thank you, Catherine. It's really great to see so many familiar faces, but also new people here in online. So my name is Marcus Wartenberg, and I'm currently located here in Germany, close to Frankfurt. And I have the great pleasure of running Sarcoma Patients Euronet together with a great board of directors. You already have seen Gerard and Vandana and Roger and different other people, and with the fantastic colleagues such as Catherine and Michi. So it's really my great pleasure to welcome you to our new online series, to the so-called Coffee Chat. So thanks for taking the time today and being online with us. And we all know during the Corona pandemic, we all learned how important it is to have online contact with our sarcoma patients, or here at SPAEN to be in contact with you, the member organizations. And many of us really made good experiences with these online tools on a national level. For example, we here in Germany, we made many patient seminars, or we also created a new cancer research academy for patient experts. but also at SPAEN, we are using Zoom on a regular basis for our board meetings, project meetings, training courses, or even multi-day conferences. So as Catherine already mentioned, we would like to offer you, the patient advocates, in the near future, 2 online formats. So one is what we call the Knowledge Spot. And this is an online series that aims in keeping in touch with all the SPAEN members and really to support their knowledge in sarcoma research and care. So for example, we will talk in the future about certain sarcoma subtypes, about clinical trials, but also other aspects that are really relevant in sarcomas. And today, this is the first edition of the so-called Coffee Chat. And also this new online offer also aims to keep really touch with you, the SPAEN members, and to support the development of your groups, but also sometimes personal skills. So mainly by sharing, as Catherine already mentioned, best experience. And we hope that these 2 series will be accepted positively even after the pandemic, because it's our interest really to be able to stay in contact also between our annual conference and other offers done by SPAEN. So I really hope you already have prepared your cup of coffee, or when I look over to our friends, we just have fed the chat to UK or India, probably tea or chai, but even where it is later in the day, nothing speaks again a glass of wine or drink or whatever. The main thing is that we really enjoy this chat together. So the first topic that we would like to offer today is the topic of, as we already mentioned, peer-to-peer support in sarcoma patients advocacy, staying in contact with patients. And it is sometimes very different, sometimes from country to country, how patients contact our organizations or are in contact with them by phone, by email, by chat or listserv, by smartphone, via social media, or even in person. And for today, we ask experienced patient representatives from the UK, from US and India to share their experience with peer-to-peer support. And this will take us around about 35 to 40 minutes. And then you all will be able or will have the opportunity to ask questions directly or via the chat, or of course you to share your experience. And we are really already looking forward to your participation and a lively exchange. So, and this is also important, if you have any suggestions for topics or requests or certain topics that we should offer in the future during Knowledge Spot or Coffee Chat, so please let us know by email. So, and now I wish you really an interesting session, and I will hand over to Sam Hackett. She will guide you through this online session and the discussion. So thank you very much, Sam, for taking this on.
Good evening, I suppose I say now. Thanks so much for having me this evening. I'm also going to do the Sarcoma UK talk, so I'm going to do that first, and then I'm going to introduce Diana from the Life Raft group to talk about the GIST Mentor programme. And then I think Joanne and Zoe are going to talk about their amazing digital support groups they've been doing over the last 18 months. And then we're going to India. We're having quite an international evening, aren't we? It's brilliant. We're going to go over to India and talk to Vandana about what's been happening over there. So it's going to be a very exciting 35 minutes. I think mine will probably be the boringest bit. But anyway, I'll get my bit over first and then we'll move on. I'm just going to start by sharing my screen. Can everyone see that?
Yes.
Perfect. Great start. So the first thing to say is that I am one of the support line nurses, and we run the support line for Sarcoma UK. And I think that although we do provide a lot of support for the sarcoma community, it's actually not peer-to-peer support, because we are nurses and healthcare professionals on the support line, and we set that up over 5 years ago. We've now spoken to almost 3,000 individual people with sarcoma, and we've had over 11,000 contacts. And this evening, I thought we would just talk to you about how we set that up and what we've learned in actually some things that we quite wish we'd known at the beginning when we started to set it up. And some things have been really helpful for us to be able to run the service for 5 years and continue to run it. And our patient numbers and actually the line is open for anyone, increases every year. We've already had about 25% more calls this year than last year. And over the pandemic, in the first 3 months, we had 85% more contact from the sarcoma community. So why we set the support line up, we had a lot more calls coming into Sarcoma UK that were increasingly difficult for the team in the office to answer. We were aware, because we were nurse specialists, having worked clinically, that the NHS in the UK was terribly stretched and now is incredibly stretched, and time to explain and support people through what was happening to them was very, very short. As a nurse specialist, you often only get 10-15 minutes with people, and what we wanted to do was create an environment where people could ring and email and text us and talk about anything that they wanted information on, anything they wanted support on, and that they could do that in their own time, and that time could be an hour if that's what they felt they needed, or 5 minutes. So we often speak to people for maybe an hour, and some people over the last 5 years, if you add up the time, I've spoken to them for over 15 hours. So we are getting to know people very well, and I think looking back now over 5 years, we can say that found our niche with being quite helpful, I hope, for the sarcoma community over here. We also really wanted to make sure people were getting to the right specialists, and we knew that that was a problem, and it continues to be a bit of a problem, but we really wanted to give people the skills and the knowledge of where they should be cared for. As we all know, that's crucially important. And so we've moved 115 people now who were not under the specialist services into the specialist services. Obviously, a big part of our role is listening and providing support, but giving people accurate information that gives them the knowledge to ask the right questions and to help signpost them to people that can really help them and their families. We do a lot of work with the sarcoma support groups over in the UK, and we work and we kind of link people into lots of different charities and support. How did we set it up? Well, there was a lot of buy-in from the trustees of the charity and a huge amount of support from Roger, thank goodness. He's always such a great star for getting things set up, and he was fabulous for us. And also the sarcoma community, we were hearing that they needed more information and more support. But we also did a lot of work before we set the support line up around working with healthcare professionals, getting a lead consultant, getting people who were engaged and wanted the support line to run, so that we knew we had good backup. We were very clear at the beginning. We spent quite a lot of time getting an operation procedure, so we knew exactly what we could offer. So what resources we had in staff, what we wanted to provide, what the sarcoma community were saying that they needed, because we didn't want to set that up and then 3 months later realize we actually can consistently run that service, and we wanted it to have longevity, and 5 years on we're still able to do it. Like I said, we are not peer-to-peer. I am a nurse. I have a sarcoma nursing background and worked in one of the Marsden for 17 years as a sarcoma nurse. My colleague did as well. We have another nurse on the website, on the support line now, who doesn't have a sarcoma background, and we now have a induction and a training program which gives a load of information which we actually give to nurses, volunteers, people who are setting up and want a bigger base of knowledge of sarcoma, and that came from us employing someone that didn't have a sarcoma background. We started a large and consistently growing knowledge base. We constantly find out new tricks and information from patients and carers calling in who say, this is a great idea, or we've contacted this support group, they were brilliant for this. We have this massive pool of information, which is hugely useful, and we share that with everyone all the time. I'm often saying, I heard from someone else that this is a really good trick of the trade, why don't you try this? And we very much, when we started, because there wasn't a sarcoma support line or support service, we actually started by speaking to similar services for different cancers. And we have a little network of smaller cancer charities that have a similar size support network. And we talk to them at the beginning, but we keep in touch with them and we speak to them regularly, and they help provide us with support and ideas and ways forward. So before we even started, we did a lot of work about how we were going to do it, what we could provide, and how we could support each other. Oh, there's my next one. Oh, there we go. So our top tips for perhaps anyone else thinking of setting up something similar would be around GDPR, which is the data. We are very clear and really transparent that we do record information from our calls and our support line emails. We give people the option to opt in and out, and some people will say, please don't collect any data on me, and we say that's absolutely fine, and then get on with the call. But we use that information to feed back into the service, really, to know that what we're doing is really helpful. Boundaries, we're very clear on boundaries. We keep, and I think that's hugely important. We've set times when we're available. So we started by being open for 4 days a week for 4 hours a day. We now do 5 days a week. We're open for 5 hours a day. We know that we can manage that. We know that when we put the answer machine on, we're very clear that we'll get back to people, and we always return calls within, well, actually we mostly speak to people the next day, but within 48 hours. And the answer machine is there so that we can make sure we do get all those calls and we don't miss anyone, but we're very clear of what we can do. We're also quite clear about signposting to the team. So signposting people back in, actually, no, this is a good call. You should really speak to your specialist team. This is a call for your GP or your doctor, or actually sometimes we've had to escalate it and we've directly contacted people because there's a significant concern. And that's all written up in our guidelines and our pathway, which if anyone is thinking of setting stuff up, we'd be very happy to share that with anyone of how we wrote that. And we have our policy and it's all written down of how we actually run it. We also thought at the very beginning about supporting how we were going to run and support the service. So we're really blessed by a medical advisory group who are a mixture of about 40 invited people, the healthcare professionals. There's some people who have sarcoma, there's family members on there, there's support group members, and they were invited if they would support us setting up the support line. We speak to them regularly. I probably contact each of them maybe twice a year for a question I can't answer. So no one is being inundated, which is why there's quite a large number. We didn't want to just have 2 and then be emailing them all the time. So that was hugely important, and that's played a great part, because if there is issues or queries, I've got a back office behind me to be able to ask. They've always been incredibly keen to be involved, and they all, well, without fail, all of them will get back with my question within 48 hours. Never had to prod anyone. They're immediate and very keen to support us. We also wanted to make sure that to do our job properly, because we wanted to make sure we were in it for the long, and I've been with Sarcoma UK now for 6 years, that we looked after ourselves. So we have a clinical psychologist that provides clinical support, counselling support for us. We do it as a group, but we do it once a month just to make sure that the kind of calls don't overload us, so that we can be very good and very good at what we're doing, but we're not getting overloaded by the psychological burden of some of the calls. And that has been, I think, hugely important. And I think when you are trying to set up a service, when you're trying to help other people, you've got to also make sure that you look after yourself, because it can get quite overwhelming quite quickly. And the other thing that we found really helpful is it's like a feedback service. We feel like we learn so much from the people that contact us, and we use that information and we collect that information. Like I say, we're very clear to people what we collect, but that help drives our service. But we also feed that back to the healthcare professional community. This is what we're hearing. When you talk to people, please tell them this bit. Please explain sarcoma as a cancer. You know, all the top tips that people are telling us, we constantly feedback. We're always talking at BSG. We go across the country doing regional meetings and feeding back to the community. And we also use that data and that information to drive policy in the UK, to get things changed, to feed into the government initiatives we're doing, so that we've got kind of the 3,000 voices of the people that contacted us are like feeding into policy. So it's been an incredible privilege to set up the support line for the last 5 years and be part of it. And we are constantly learning, but I think we were also very privileged by our trustees and people like Roger that enabled us to do it, but also to make us stop and think, how are we going to do it? How do we look after ourselves when we do it so we can do it well and for a long time? And who do you need to pull from the community around you to help you do it as well as you can? So that was my short presentation from the Sarcoma UK about how we set up our support line. I will unshare my screen, I think. Is that right? And I'm going to move on to Diana, because I think we're going to do all our questions at the end. So I'm going to move on to Diana to talk to us about what Life Raft Group have been doing with their GIST mentorship program.
Thank you so much and for the warm welcome and for the invitation to be here. I am going to share my screen. Everyone can see that. All right, so I'm here representing the Life Raft Group, Senior Director of Outreach and Engagement, and I am here with Piga Fernandez, who is our Global Relations Consultant. I'm going to provide an overview of our mentorship program, and Piga is going to provide a perspective on the global GIST mentorship, as she is a mentor herself. Basically, we wanted to talk about the mission. The mission of this mentorship program is to provide people who have GIST and their loved ones with support along their GIST journey, from diagnosis to treatment and to recovery. The mentorship program exists to help these patients and caregivers be strong advocates for themselves and also provide emotional support along their journey. The mentor qualifications, they are members of the Life Raft Group. They belong to the patient registry program. They're also volunteers of being a mentor. They've received ample training, GIST 101 training that we do offer to everyone, but they have experienced that, and continued training throughout their mentorship program, from empathy, communication skills, to even information about COVID and the booster shots and grief support, anything that you would imagine. We do offer training for along the time that they are a mentor. They are also great listeners, and we do encourage that along the journey. And they also have the ability to have communication, whether it's by phone, WhatsApp, email, video, through Zoom or Google Meet. They do have those capabilities. Now, the Mentee requirements, we just ask them to be LRG members. They have a desire to participate in the program and have requested to be connected to a mentor themselves. And in terms of the mentee and mentor relationship, we ask that there is a communication within the 48-hour time frame. So when a mentee requests a mentor, myself and Piga would connect with that person to let them know, hey, this is your mentor, and the mentor would communicate within a 48-hour time frame. We do ask that the mentee contacts the mentor upon the mentor reaching out to them to let them know, these are the best ways that I want to be contacted. This is when I'm available, so that there are boundaries within the relationship and the communication, and everyone is on the same page and they agree to those communication. And in terms of the time frame, we look at the time frame being 6 months to 1 year. And at that time, the mentor will ask the mentee, hey, how are things going? Do you want to continue this relationship? If so, yes, the relationship continues. If not, great. The mentee can apply again or request to have a mentor again in the future if they feel the desire or need to connect with a mentor again. So that is open to them. And one other thing about matching the mentee with the mentor, we do look at geography, where the mentee is located, and try to connect the mentor with that person within their geographic region. We match patients to patients and caregiver to caregiver, so that there is that commonality. And we also look at, depending on whether the mentee shares the information or not, we try to match according to mutation or history. But again, along with confidentiality, we do not request that information. It's only when the mentee willingly offers that information and we are able to connect them from that perspective. In terms of data, we have almost 200 mentees, and right now 25 mentors overall. There are 17 US mentors and 8 global mentors from Canada, Chile, Austria, Singapore, Kenya, and India. And we are looking to continue to grow the program as we continue and track this. And it's been 2 years since it's been in existence. We have received a lot of positive feedback, but now that we're coming to the end of the 2-year program, we will be sending out a survey to inquire, what we can do better. We're always looking to improve upon what we already have in place. So now I'm going to pass the baton over to my colleague, Piga, for her perspective.
Okay, thank you, Diana. That was quite complete. I just wanted to add something from 2 different points of view, from a patient, because I'm a Jewish patient, and also as a mentor. And why do I think that this program is really important, whatever way, just a phone line or what we do in the Life Ref group, is because I had to go through that same minute when I was diagnosed a long time ago with something that very few people knew about it, and that desire of finding someone who was going through the same thing that I was really a necessity. And that's why I started searching, and I found the Life Ref group. But I think that from my experience, I know what it means to find someone who's going through the same path that you're going. And also with my experience here in Chile, because I have a Just Foundation here, when we made meetings with patients or caregivers, you always gave them a topic or a speech or something, but we found that the patient and the caregivers enjoyed a lot that moment of the coffee break or afterward, just talking among themselves and sharing their experiences. So we saw that there was a necessity there. So since that moment on, on our meeting, half of the meeting was kind of educational, and the other half was just talking about each other, so that everybody could express what they was going on. And from my work doing globally, we could see that the need has no boundaries. I mean, all over we need the same. We need to talk to someone and it's very helpful to talk to someone who's going through this journey with a rare disease, and that we any cancer diagnosis it's frightening, but especially a rare cancer when very well. Now it's not so, but very few people know about it. And I think that it's for me also, it has been really a gift from being mentoring or being working on this, because when you see how, when you talk to someone at the beginning, we have all those fears and anxiety of the unknown, of what's going to happen. And when you start talking to them and tell them that you're going through the same path that they're going and that you're there for them, their faces immediately change. And all that anxiety and fear kind of slows down. And you see the face when you talk by video, or you can feel it when you talk by phone, the change in the way we started the conversation and how we ended. And as we also with Diana, we tell them always, we are here for you. I mean, that phrase means a lot, and they know that it's true, that whenever they want, they just can send them a message or call us and we'll be there. And the other thing that I would like to point out that it's very important is to be very respectful of the different stages where the patient or the caregiver is going through, because, for example, when I was just diagnosed and I finally found that there was Gleevec and I would have a drug that would save my life, I just didn't want to know anything about cancer. I just wanted to take my pill and that's it. But that was at the beginning. Then as time went on, I just wanted to know more and I start looking for more information. And I think all the patients go through different stages, and we have to be very respectful and just tell them what they want to ask for. And as long as you go along through that conversation, you realize what they really need and what is that you are willing to and you are capable of telling them. So that's what I would like to share you. And I think it's really a gift being part of this, because there's a relation that strengthens with the patients. So thank you very much.
That sounds like such an amazing project, doesn't it? Wow. Gosh, that's amazing. I've got so many questions for you, but I'll hold off. Right, Joe and Zoe's going to talk now, if that's all right, from BCRT. I think you're on mute, Zoe.
Oh, there we go.
There you are.
I couldn't unmute myself. I was panicking then. I couldn't unmute myself. Okay.
Hi, sorry, I couldn't unmute myself either. I've just managed to work it out. Sorry about that.
Hi, Joe.
Okay. So hi, everyone. Thanks so much for inviting us to speak today. It's really, really great to have a kind of informal chat and share our experiences with everyone. And it's good to hear your experiences as well. So Joanne and I are here tonight to talk to you about our digital groups that offer a form of peer-to-peer support for our patients. So just a little bit of background. So we're from the Bone Cancer Research Trust. So our patient group are bone sarcoma patients. So that's who we focus on. And a little bit like Sam said from Sarcoma UK, until fairly recently, support has always been kind of a charitable pillar, but we haven't had a dedicated support line. However, the calls to our office were becoming more frequent with more challenging and ever challenging kind of questions that actually the staff team in the office just couldn't handle anymore. So luckily, every year we hold a patient conference, which in itself is a type of peer-to-peer support. It brings patients together for a little bit of a respite, really. They come together, they stay in a hotel, they get to meet each other, they get to interact with our researchers and our clinical community. And it's just a really, really nice weekend of bringing people together and kind of hope. And so we knew we had to do something. We had to up our game in our support service and formalize it. So we used our patient conference as a means to get feedback from our community, because if there's one kind of key piece of advice, it's really, really ask your community what they want, because you might have something in your mind, but it's very, very different to what patients might want. So we asked them all kinds of questions about what they wanted from a support and information service. And of course, a kind of dedicated phone line came up, but actually peer-to-peer support was really, really high on their priority list. And so we kind of took that away and we started to think of how we might deliver that. And we held some patient focus groups and worked with kind of the wider staff team. And actually we knew that there were Facebook groups out there. However, we were slightly worried about how they were managed and policed. So we decided that we would set up our own so that we could properly control them and make sure that the content that went in them was okay. So I'm going to share my screen now so you can actually see what our digital support groups look like. I don't have a presentation, but I'll be able to talk you through how we've set them up. So let's see if I can do this. Can you see my screen? It's got Facebook open.
Yep.
Yep. Excellent.
Yeah, see that.
So we decided, kind of from advice from our patient group, that we wanted to set up a Facebook group for each type of primary bone cancer and tumour that we cover. So we have 9 groups in total, which cover the types of bone sarcoma, plus one for ameloblastoma and one for giant cell tumour of the bone. And it's something that our community asked for because the questions and the topics that might come up are quite different, particularly in the benign ones to the malignant ones, and we felt it was best to keep them quite separate. So we have one for each form, and you can kind of see how they look here. And so when we were setting them up, kind of privacy and keeping people safe in this space was our priority. So we made the groups closed, and if someone wants to join the group, they have to answer a series of questions which we validate to make sure that they are genuine people, genuine patients or family members of patients, and we have a set of rules that everyone must abide by. So if I just come down here, so we can see some of the rules. And a piece of advice, if you do think about setting up Facebook groups, I think having an opening paragraph about managing expectations about what the group is for and what people can get out of it, and then rules for what they should abide to keep everyone safe, about spam, about alternative treatments and things like images and photographs, I think is really, really important. And I would really encourage anyone to kind of think about that before they dive straight in. It can throw some quite significant problems. So anyone can find the groups, so they're visible. So you don't have to have a secret code to get into them, but you just have to apply to be a member. So the groups are moderated by our support and information team. So one thing to bear in mind, depending on how busy they get and the numbers in them and the amount of posts, it can be quite time consuming to moderate them, to make sure that the posts that are going into them are okay and they abide by the rules. However, the discussions that are generated out of them are discussions that we would never be able to have with those patients because they are life experiences. And that's the main reason why we set these up, because Joe and I don't have those experiences. We've spoken to a lot of people that do, but we haven't been through a diagnosis of a primary bone cancer. We don't know how it feels. We don't know the kind of gut-wrenching anxiety that a parent might face if their child's diagnosed. And I think the fear of the unknown, we find a lot of the questions and the discussions are around, this is going to happen to me next week, I'm going to this appointment, what am I going to expect? Please tell me someone's been through this already, and what should I do? What are the questions I should ask? And that's where peer-to-peer support in these groups really comes into their own. And like I said, it's not something that me and Joe can comment on really. But we have had questions about lots of things, and some of the questions we do respond to if they're more kind of where are the specialist centres? I'm being seen at X place. I'm a bit worried it's not the right place. Can someone let me know? So we do respond to some of the conversations. And as an organisation, if you're setting these up as an organisation, because we've got quite a few people in these groups, it does actually provide a really good mechanism to communicate key things like our conference, like various key support events, to quite a big group of people. So they've been really successful, haven't they, Joe? More successful than we imagined when we first set them up. And we've actually got members from all around the world, which in a rare cancer, that is really, really good. It breaks down all the geographical barriers. So just to give you an idea of numbers, so we have the different types. So in our Ewing's group, we have 239 members, osteo 304, chondrosarcoma 195, chordoma 67, spindle 40, adamantinoma 55, angiosarcoma 18, which is a very rare type, GCT 198, and ameloblastoma 98. So the numbers are quite high, and it does generate some good conversation and chats. One thing that we are starting to think about, and it's something that people might want to think about, is to have kind of a more kind of maybe general group as well, if that would work, or maybe a kind of a separate bereaved group, because some of the particularly the bereaved parents might need a kind of safe space to chat. So yeah, does anyone have any questions? Or we do questions at the end, Sam?
We're going to do questions at the end, Zoe, if that's all right.
Yeah.
Just so we keep to time.
I'll just stop sharing.
It's very interesting. Gosh, there's so much potential, isn't there? So many different things we could all do. My brain. Now we're going to India. How exciting. Where's Vandana? Oh, there we are. Perfect.
Thank you very much for this opportunity to talk about something new. It's really not something new, but it is something which is picking up a lot. So next slide, please. I'm from VK Foundation, and Sandeep is a cancer survivor. He's worked in VK and different organizations, and is now the founder of DigiSwastha, and we are very proud of him. Thank you. And next slide. Okay, so before we even start talking about the challenges or anything, what I want to explain to you is to understand the demography of India. 10% is urban and about 90% is rural. So the divide is a great divide. And most of the good hospitals and doctors are in the 10% area, and most of the population is in the 90%. Now, so for the patients to reach the hospital, it's a huge challenge because they have to move from their hometowns and come and live in unfamiliar cities and unfamiliar circumstances. The surroundings around them is not something that they know. The language may be different. And it's a huge difficulty that they face when they move from the village to the urban areas. Now, earlier, what had happened, this project has started for some time, which is the digital, telecommunication, and it was understood by the government, and that is how the whole thing started. But it wasn't picking up for various reasons, because, people were not familiar with talking on Zoom calls or even talking to a doctor on the telephone. Many people didn't have the resources. like a smartphone or, like something like that to talk to the doctors. They were scared to take an appointment with the doctor to be able to talk. And how do you show your report? So there were multiple challenges which were being worked on. So now what has happened is that a good thing that happened in COVID, everything was bad, that this digital communication and digital health took priority because people were unable to travel. There was absolute lockdown in the country for almost 3-4 months. And so what do people do and how do they go about it? Fortunately for us, Sandeep was in his village at that time and he was undergoing various courses, and he decided to take up this challenge and work on it. So the first, that was the major thing that happened with Dijaswastha, and that is how we started it. Because we had to face the economical challenges and we had to face the technical challenges. People had both these problems and they didn't know how to move forward. So, because like I mentioned, that they didn't know technology and they didn't know, and they could not come here. So how do they take care of health? Next, please. So then the solution that we thought of was the telemedicine center in at least to start with one village. And then, of course, move on if it was going to work out. And this is, like the government of India is also built up a big platform, which is called the Atal Incubation Center. Atal Bihari Vajpayee was one of our prime ministers long back. And so the whole project is, named after him. So anybody who is getting digitally connected is accepted by Atal Incubation Center, they become a part of it. So it becomes like, from the hub to the spoke. So many more people have joined it. And the absolute idea of this program is to create awareness, accessibility, affordability, and aid. I think it's a fantastic program which has come up, and we have to be very proud of our government and of the people who are working on this program. Next, please. So the process is very simple. People come to you, they give you all the issues that they have, and then they move on to talk about it. The reports are generated, they are guided into what has to be done. All that goes to the doctors see them, and then subsequently they guide them on where they can get the prescription, what can be done, and how it has to be done. So, and the best part is there were a lot of local doctors who were not connected initially, but this gave them a chance and a platform to connect. So we got a lot of people from the local community to join in the process, which was a big help because even those doctors were recognized and they were the ones who were connected to the senior doctors or the better known doctors in the big cities. So it became a collaborative affair between the people who knew and the people who were eager to learn, the patients who needed the treatment and the patients who could not get the technology or move to the bigger cities. So it was a win-win situation for everybody, especially since the technology had been taken care of. Next, please. So now I will ask Sandeep, who has been working on the entire thing along with his team, and Dr. Pallavi, who is there, is also in the program. So Sandeep, please go ahead and carry on with the presentation now.
Yeah, thank you so much, ma'am, and thank you very much, team Sarcoma. So yeah, so here are the numbers that we have established with 3 centers across the country, and we have 70 plus doctors on board, and we have served around 1100 plus patients with online consultation, and also more than 64 patients diagnosed with cancer, and also we referred them for their further treatment to the treating center, and also we conducted around 30 plus awareness camps in villages. So next slide, please. So here is the here are the pictures from the second wave of the COVID-19 in India, where our donors graciously donated in terms of funds and equipment like oxygen concentrators, which helped us to save lives. Next slide, please. Yeah, the on-ground camps and webinars, which we conducted on the weekly basis. This includes creating awareness about healthcare research, educational, the masses, and provided a platform for one-to-one discussion, conversation with our speakers, doctors, and also social media interactions through Zoom or Facebook, etc. Next slide, please. So yeah, I would be happy to share more about how you can re-applicate with your communities. This slide has all the detail, and you can reach out to us. Yeah, thank you very much.
Thank you, Sandeep. So what I want to say is it's a very innovative project which has been widely accepted. And if there's anybody who would like to replicate this entire process, I don't know whether it works in your country or not, but we'd be happy to share what what we've gone through to bring it up to this level, and whatever pitfalls that we faced. We can always tell you about it. But I think it has the technology has really been good. If we didn't have the Zoom platforms, we wouldn't be able to connect. If we didn't have the ability to share it on the Facebook, it would become difficult. And a lot of people have benefited out of it. The fact that so many cancer patients could go, and it's just not cancer. We are doing other diseases also in Dijiswastha. So I think it's a technology boom which has come and helped us. So that's why I say COVID has been a boon in some way. I mean, I don't mean it any other way except for the help that the patients have got. So thanks a lot, and thank you for this opportunity.
Thank you so much. That was so interesting, wasn't it? I'm going to open it up to the floor. I think there are some, I've got a few of my own questions, but I think there are also some questions that have come through on the chat, which I'll have a quick look at. Oh, is that one for me? Do you think the support line is reaching more people than wouldn't otherwise be able to access this information? And maybe the type of people in lower SES or lower education levels. So I think what we really wanted to do, and I'm sure it's the same for a lot of other people who were on this evening, we wanted people to get the right information, because we know people were accessing all sorts of information that perhaps wasn't relevant and helpful for them. So I think the support line is able to do that, and some people definitely weren't getting the correct information or any information. So that's one thing. I think we're very good at, and because you get more time perhaps than sometimes when you're in a clinical environment, when you're busy doing surgery and all sorts of things, we perhaps have more time to listen and actually understand what it is people are trying to ask, what their understanding is, perhaps where the holes in their understanding are, or in the information that they were given. So I suppose perhaps in that sense, we're more accessible than a booklet that might be harder to read. And yes, you're very welcome. I am paid, I'm a nurse and I am paid. And yes, I can absolutely get the information on our how we set it up and our guidelines to you for the policies. And whilst I'm still talking, I just had 3 questions for the speakers, and then anyone else, put your hand up and join in whenever you're ready. Oh, actually, Anna already has her hand up. Go for it, Anna. You're still on mute though.
Yes, hello to everybody. First of all, my heartfelt congratulations to all presenters for all the initiatives, because they are all valuable. But my particular admiration goes to India and to the way you have managed 3 clinics to handle so many patients. Really, it is amazing. And really, my compliments. I have a question. I have a curiosity. Do you charge anything to your patients, or do they give you any offerings? Or in other words, how do you finance all these remarkable work, Vandana and friend?
Yeah, so most of it is we are receiving a lot of donation from people for enabling us to carry on this work, and we don't really charge the patients unless there is a patient who wants to make a donation. He is more than welcome, but it has to come free, otherwise the patient will stop coming there, because during the COVID times, all the 3 clinics have come up during the COVID times. There were a lot of people who lost their jobs. There were a lot of people who, because the family members were not living because they were affected by COVID or something. So the finances was a hardship. And as you know that in India, we don't have a very good insurance scheme for the patients. So we want to build up the entire thing by having donors donate to it, so that we can reach out to as many as possible. And once the people are able to afford to pay, then definitely very, very marginal, but so that is how we would go about it. But as of now, it has to be a pro bono consultation, and we are trying to see if we can help them with buying medicines or whatever is possible. So we Digiswastha did win an award from Spain also, and so that money came in very handy, because we were able to do so many things with that money in Digiswastha.
And Vandana, do you think that the process has sped up the diagnosis of the people being diagnosed with cancer? Do you think the telemedicine has sped that process up?
Can you repeat your question, because there's an echo which is coming while you're...
I just wondered whether the telemedicine has sped up the process of diagnosis.
Are you saying that telemed consultation has broadened the diagnosis or not broadened the diagnosis?
It's sped it up so the person get diagnosed quicker?
Yeah, it definitely, because see, traveling in anywhere, if you have to travel from one place to the other, from the villages to the town, it's at least a 48-hour journey, because they can't afford to travel by air or something like that. And then taking the appointment with the doctors and meeting them and talking to them. Here, we are creating the awareness material which is given to them. And also then they are able to, if they have some issues, and we guide them into the reports, because Sandeep himself is a cancer patient and he knows the type of things that need to be done. So all those reports are then taken in the hospital and then put to the doctor to see and talk. And so naturally it is a fast turnaround as far as the treatment is concerned.
That's really interesting.
Thank you.
Brilliant.
Sandeep, you have something to say?
Yeah, and also we have collaborated with all the diagnostic centers, radiologists, and we provides more than 50% concession on each investigations, like X-ray, CT scan, PET CT scan, MRI, etc. So it also helps to them to get the reports, and after that we connect again with the oncologist or the surgeon doctor, and they provides right information and diagnosis. If they require to move to hospital for further treatment, so we create the referral pathways, and also we send them to Mumbai, Varanasi or Delhi for further treatment, like Tata Memorial Hospital, Hinduja Hospital, etc. Yeah, thank you.
So one good thing that has come up is, I mean, there's been a success in it, because some of these centers are in a state called Uttar Pradesh, and a new Tata hospital has opened in Varanasi, which is in the state of Uttar Pradesh. So that becomes the hub for us to be able to send the patients there, which is like not too far off from these centers, like it's an overnight journey and people are able to reach there, and the doctors are very cooperative and helpful. Only for those where, more expertise is needed, that we send them to Bombay, and then they are taken care of in Mumbai in various hospitals. So I think even the doctors are happy with the collaboration and the help, and we are happy that, they are spending so much time in helping the patients, which just shows that everybody wants to help a patient. It's just that, you get stuck in the time race in India, because of our population, the number of patients are so many that if they were going to specialized centers, then the line, the queue, everything becomes too much for patients. Here they are getting all the information in their hometown before, if there is a need, only then they move out. So that's a good part of it.
I think it's a wonderful service. I think we could try and use it in the UK. Is your brain whirling, Roger? I can see your brain, Roger. It's whirling, isn't it? I can see him. He's so excited from what you're saying, Van.
If we can help in any way, we'll definitely be happy to do that.
I'm full of admiration, Vandana. I really am. There's a model in what you're doing with this huge country you have and the enormous numbers of people, which somehow we can translate into a much more squashed up country. Because we have got those hub centers already, and we could achieve something which, hopefully gets rid of a lot of the diagnostic delays that we do have in this country. So really fascinating, really fascinating. Sam's absolutely right.
The whole thing started like, we were talking about video calls and talking to the patients on phone and all that, and that really ignited the whole idea that if we can do that, and if our patients can be educated in doing it, then we can move on to the next level, And we also encouraged, or I wouldn't say encouraged, but we also spoke to the hospitals about it, to open telephone lines in the hospital, where we knew that in a particular time the doctor would be available to talk to a patient and do the teleconsultation. And it was all because of COVID that all this was possible, because the doctors also realized that if a patient was to travel, because like I know that there was a patient who traveled from about overnight, train journey, and there was no train. So he had to take a car, hire a car. And because he was a patient, he was allowed to travel. Otherwise, he wouldn't be able to come. But there was no place that he could stay. So he slept in the car because he was only coming for an OPD procedure, and so he could not go into the hospital. And he had to carry food with him because all the food shops were closed. So there was nothing that he could get, so we had to try and arrange something for him to eat, so that he could eat in his car and sleep in his car and use the washroom in the hospital when he went for his checkup. And then the next day he went back, so those are the type of hardships patients faced. And when we narrated these incidents to the doctors, they were more than happy to. It took a little time to set up the lines and, to say which disease management group will be there and which time and all those things. It takes a little time, which was good, but they were all available. And then, the doctors also helped us in having Zoom calls for specific diseases. Like there was lung cancer group, there was children, pediatric cancer groups, and there was sarcoma groups and all that. And the doctors were present there. So people could send in their questionnaires and, doubts and queries, and the doctors would answer. And the amazing part was, Roger, that everybody learned Zoom and Google Meet and to be on the telephones and all these things in such a short time. Somebody like me who was totally ignorant also learned. So we all learned to do that.
And now it's becoming, is this now regarded as the standard? Is this regarded as what happens regardless of COVID?
as of now, I think it is the standard because, you know, people can see the convenience in the entire process. But I think gradually it will be like a hybrid thing. You know, some may want to come here and some may want to be in their hometown and use that.
And it's quicker and it's more accurate. I think it's brilliant, Vandana. I really do.
Thank you. Thanks a lot. Thank you.
I wondered whether anyone had any questions from the other talks we had. I wanted to just to pick up with Pika a question, if she's still here. Pika, I just wondered, because when you are mentoring someone for a long period of time, how you look after yourself and whether there is an impact on you. I know there's lots of positives of the engagement and helping someone through, but how do you look after you?
Well, that's a great question, because it's something that many times there's very difficult to put a boundary, know where you stop, because you get in this relation. But I try to tell them that I'm available in certain times of the day, but you know, the patients are really responsible with that. They know that you're a patient too, so they understand that you're also. And I tell them I'm a patient just as you. And I'm not afraid telling them, you know, I'm gonna be this weekend out or whatever. So just be very sincere with them and tell them that I'm just one of them too.
And you don't ever find it overwhelming?
Yes, you know, but you know what is more overwhelming for me here in Chile is that we don't have all the treatments that are available there. So when you have a patient and it comes to you and you have to tell them, well, yes, there's a treatment, but you don't have access to it. I mean, that's the worst that's the worst part for me. How can you tell them because you don't have enough money, you won't get the drug that you need? I think that is the
heartbreak.
Yeah, and the other, well, sometimes now and then we have a psychologist here on our foundation, and sometimes I just talk with them to let them know what are my fears, and they help me a lot and guide me a lot also.
And with the international mentorship program, that idea of what's available might be quite difficult. Because different things are available in different countries. Will the international mentorship program be finding mentors in specific countries to match, or will you be being matched with anyone in the world?
No, we try the mentor in different countries are from organizations that they're already suggest organization. That's very easy because you guide them to them, they know. And when there's someone that doesn't live in a country that doesn't have an organization, I chime in, or someone in the nearby. So it's from Europe, some from Europe. But this international program it's very young, and we're just on our first steps. So we haven't had much that problem that there's no one that can support them.
Great. It's really interesting, isn't it? Sometimes we have linked people together, and perhaps one person doesn't do so well with their treatment than the other, or there's a bereavement, and I always do worry about the person who's been the mentor in that situation. But it sounds like with Life Raft that you have great support with the psychologist and each other, obviously, as well.
Yeah, it's difficult because I have been on liver more than 16 years ago. And when maybe I can talk to someone that after 2 years they progress. So how can I tell them that, well, I'm doing okay, you're not? But if you explain them whatever the science is about the different treatments, and you have to explain them the truth and just the things how they are.
Mm-hmm. Yeah. Oh, am I missing questions? Let me have a quick look. Sorry. There's a chat going on. Have I missed any question, Mika? Am I okay?
No, you
haven't.
Good. I actually have a question, if I may. Diana and Pika, how do you said you do a lot of training for the mentors, but how do you make sure that those mentors have the same values? I mean, it's if they're on one-on-one topics, it was mentioned before, like alternative medicine. That is something that is very individual, but can be very dangerous. How do you make sure that these mentors really think along the same lines? How do you make sure?
I'm not sure if Diana's there. If she's not,
Yes, she's here.
Yeah, okay, Diana.
Thank you. So as part of the process, we do an interview of the volunteer who's interested in becoming a mentor. And they meet with me and also Piga and or Santi, who's the US representative, to make sure of these kinds of things. There's communication, there's understanding of what that person is doing for their own just journey. Also, we meet as a group on a monthly basis. And so the mentors communicate with each other. So there's a strong understanding of what's happening. And we also remind them, you know, we're not medical professionals. Each person's journey is their own. And we strongly encourage them to speak to their doctor, to their specialist. So it's something that we reiterate. And we're in such a small community that so many things get around really quickly. So any issues, you know, we're going to, you know, understand and learn, and then we go back and educate and rectify any issues if they come up.
Do you have any kind of documentation what's going on between mentor and mentee?
That's an excellent question. We do have a mentor manual that the mentors came together with LRG to put together of some guidelines of things to cover. And there's also a form that each mentor can fill out to track information about each mentee.
Thank you. That sounds really, really interesting for the project days.
Thank you.
And I had a question for the BCRT. I'm doing a lot of questions, so anyone else interrupt me, because I'm known for talking. I wanted to ask Zoe or Jo, if she's still on, just with that, when you're moderating one of your groups, I know sometimes you can have someone that perhaps is quite upset or goes off on a particular direction that perhaps isn't well researched or around the alternative treatments. How do you go about moderating? Does the group self-moderate most of the time, or do you sometimes have to step in?
That's a really good question, Sam. I think most of the time the group does self-moderate. People be pulled up on things they might have said in the group. But there have been times when we've had to take people out, you know, take members out of the groups because they might have done some advertising or spammed something or something like that. But most of the time, it's the peer-to-peer groups moderate themselves, so there's not really been an issue with it.
And how did you come up with your 9 groups? Was that from your focus groups? Like, I mean, there could be so many groups that you could do. Was it from the focus groups?
Yeah, I think so. Was that was before my time, but was that from the focus groups?
Yeah, that's right. It was through working with the patient groups and asking them what they wanted. And they came up with one per kind of type of primary bone cancer and the bone tumours that we covered. Just going back to the previous question, Sam, the moderation, there's different levels in the JO. So sometimes if it's a very emotive post, we'll kind of ask them, we'll message them to make sure that they're okay, because we have to make sure that they're okay and kind of in a safe space. So we will message them or contact them and let them know that our support and information line is there for them, or we'll post it in the group as well, that they can contact us through that, just so that they know that they can contact us as well if they want to talk about anything in more detail. So there's kind of different levels of moderation, isn't there, Jo?
Yeah, that's true. That's very true.
I know that's over the years there's been sort of different Facebook pages and support that we've been involved in, or some of the people that are involved with Sarcoma UK. And after a while, I think when it's patient-led, it can be quite difficult to constantly moderate a Facebook page. So I think the fact that there's more than one of you moderating and getting, you know, making those ground rules that you had at the beginning are so important. And some of the stories I've heard from people who've kind of joined other Facebook pages, which they've ultimately come off of, they can find quite upsetting because there aren't those ground rules there, and there isn't someone moderating, and it isn't, like you say, Zoe, that safe space that you want people to have to be able to really talk about their anxieties and concerns and learn from each other. It is truly really important.
It is, and I think with the other Facebook groups that they're run by volunteers as well, and so they might try to moderate them as best as they can, but it's impossible to do it, especially when they grow to such a size. So I think that's why we wanted to have our own, so that we were confident that we could do that.
Yeah, I think it's really important. It is. I know that people before found it a real struggle. Is there any other questions? Am I missing any arms?
Maybe is there something that someone else would like to share?
Yeah.
Because I know we have picked a number of projects and initiatives we knew about, but sometimes we're just not aware. I know you all do a lot of great things. So is there something that we missed for this topic? Anything you would like to share?
I think, Catherine, there is another peer support service that's just been set up recently. I think it's called Bone Sarcoma Peer Support or something. It's, you know, it's quite a straightforward name. And I think Sarcoma UK know the chap that set it up, don't you? Andy, is it?
Andy's doing it, yeah.
Yeah.
That's very specifically osteosarcoma, and that's very specifically peer-to-peer.
Yeah, is it? I thought it was all for all bone sarcomas. I didn't think it was just for osteosarcoma.
Okay, I might have to check my facts. I thought it was just going to be an osteo group.
No. I think it's for all bone sarcomas, but that might be useful for you to contact them, Catherine, at some point.
Yeah.
Thank you very much for that. Yes. Anything else?
Do we have South Africa on?
I've seen Lauren before. I don't know if she's still there.
I was
was
just interested in going around the world for everyone that we had, just to see what was happening. But maybe she might have come up now.
Unfortunately, she's not with us anymore.
No. So if there's no more comments, then should we start rounding it up? Because I think we're coming up.
Vandana is showing her hands again.
So do you think it's a right time to ask people if they would like some other topics to be covered for the next meeting?
Yeah, why not?
So maybe we can take some suggestions, and then the bank will become bigger for the next chat. It will become easier.
Yeah, absolutely.
Something new that they might have learned that they would like to share, or something else that they would like people to share with them.
Or any kind of topics we should cover.
Yeah.
Any issues you came across. Yeah, sure.
Did any of you have any funding problems? Like, because jobs were rare, people's business was hit. So, and at least in India, a lot of funding went for COVID. So did any of you suffer the same thing? Did you have a problem with funding? Would anybody like to talk about it?
I think all the charity sectors in the UK have seen a drop in their income, certainly last year, and lots of money, like you say, was going towards COVID, and lots of people were furloughed or not working, and more importantly for many of the charities, things like the London Marathon and the big occasions for raising lots of money were put on pause. They're all up again and running. This weekend in London is the marathon, but I think that there was a dip, definitely, and all worked in different ways to bring more money in and tighten our belts and work in a different way. But hopefully that's starting to change again slowly. While in England, people are out running and cycling and jumping out of planes again and doing all the things they do for us to raise money for us to do our jobs. But I don't know, what was it like? What's it been like in other countries?
Oh, Russia's doesn't have that.
Oh, Rashi, sorry. Yes. Rashi, you have your hand up?
Yeah. Hello, everyone.
Hi.
It was good to hear everyone, and the topics covered were really very relevant. I'm responding on Vandana Man's query related to funding. Yes, surely this pandemic has affected everyone all around the globe, and it has surely affected the funding part, because many people have lost jobs and people were struggling, and this is definitely an issue which I guess everyone must be facing. And we hope that this pandemic gets over and all of us continue to provide support to the patients and also help them as far as the financial aspects are concerned. And this problem should solve as early as possible.
Manish?
Hi, yeah, thanks. I'm Manish from the Desmoid Tumor Research Foundation.
Oh, hi, Manish.
Yeah, and we're thinking about starting a nurse navigator program as well. So Sam, if you could provide any information as to those questions at the beginning. So any guidelines or policies would be great. But another topic that I think might be interesting is something that we've been thinking about is providing like a find a physician resource on our website for patients to help find the right care teams. But as we talk about that with our advisory board, we get some pushback. Like, do we want to be recommending these doctors who may not have the expertise? How do we find the ones with the right expertise? They may see a lot of desmoid patients, but may not be great doctors, right? So how do we kind of balance that? And do we want to put that on our website? So if any other organizations have experience with that, that might be interesting to talk about. Not now, I think it's a bigger conversation, just as a topic for a future chat.
Yeah, I think recommendations and second opinions is you have to get your boundaries right for sure. We're quite lucky in the UK because we have set specific specialist centres, so they're on our website, but that's where people have to go in. Our desmoid patients are very much meant to be going to those specialist centres, so it's very easy to guide them, but I know that that's not the case everywhere else, and certainly in the States.
Yeah, and I think
that's very difficult.
Is even at the sarcoma centers that we send them to, there's not necessarily a desmoid expert at that sarcoma center.
Yeah.
So then it becomes another challenge in that. So.
But it's a very interesting and very relevant topic. Thank you for raising that. We will definitely put it on our list.
And just thank you all very much. It was a very interesting webinar. It was very helpful.
Thank you. All right.
Shall we round up?
Yeah, I think so. I don't see any more questions. Yeah.
Do we get to see Mickey's cat again?
I don't know. Mickey, where's your cat?
It's sleeping now. I think it's hungry, and it was a bit bothering me. And but now I told him to be quiet. So let's see how long.
Well, listen, thank you so much, everyone, for joining us this evening and for inviting me on. I've loved every minute of it, and I will absolutely be in touch with anyone that wanted any information from me. And thanks so much for our speakers from India and from the UK and from Chile as well as the US. Wow. And to everyone else that have joined us. And I'll hand back over to Catherine and Nikki to say goodbye.
Yes, I can only second that. Thank you very much for your contributions today, for great presentations, very inspiring presentations. And I think it's not only Roger's head that's whirling. That's what you said, right? So it's there is a lot to think about and to take away. I hope you feel the same. Thank you for taking the time to be with us tonight. Thank you to our presenters for preparing and sharing your expertise and answering all our questions. Thank you very much to Sam, who did a wonderful moderation tonight. And maybe one last thing I would like to share with you. So some of the presentations we've seen today have been entered into our award program. We have a SPAEN Advocacy in Action Award, which we announce every year. And the next one will be announced within the next couple of days or next week. Michi, help me out on here.
Yes. Next week. Let's say next week.
So keep an eye out. As we heard from Vandana tonight, it might be helpful to get some additional money to help others. So it would be wonderful to hear from you, to learn about your projects, what you do, and also to maybe honor it with winning a prize in our award program. So thank you very much. Hope to see you again soon. Stay tuned and have a wonderful evening and afternoon.
And good night from India to everybody.
Goodbye, everybody.
Bye, everyone.